that are going to be happening there. 99.9%, I think it's safe to say, would not have any idea what the World Health Organization's calendar looks like, doesn't necessarily put it on their own Google calendars. What practical steps can families say when these things start to come out and say, and you get this idea of a new introduction of some fear? What are the red flags that you say this is something I need to be looking at, or this is just another way to manipulate the public's mind?
Well, probably what I look at is different than what the average person looks at. I want to know specifically what kind of PCR test is being done to diagnose people. I want to know what the entire genetic sequence of the hantavirus or the Ebola virus, and I want to know whether certain tests have been done on people who we think were exposed that might actually tell you whether they are incubating the disease a couple of weeks ahead of time. We haven't heard anything from the CDC about the details of their testing because they don't want us looking over their shoulder. They did the same thing with COVID. They don't want us to be able to criticize them, but they want our trust, and how can they earn our trust if they don't allow us to look over their shoulder? Now, what can the average person do? I think the average person just needs to put all this aside and realize this is a game, they're running the game on us again, and ignore it. There are more people who come back to the United States that were exposed on the MV Hondias ship, and they have, they're being monitored by their state health departments, or they've gone to Nebraska to be quarantined there for 6 weeks. There's one woman who is basically on life support in France, who did come down with Hanta, and everyone else is just being watched. And there were 3 deaths. So 3 deaths, 1 person on life support, a bunch of people being watched, and that's it. And yet we've heard about this nonstop for at least a week. So really forget about it. But even in Argentina and Chile, which has the only hantavirus that spreads person to person, even that particular hantavirus only very rarely spreads person to person. 90% of the people who've come down with it got it directly from rat droppings. And even if you share a household, the chance is like less than 10 or 20% that you will catch it if you are in the same household with someone. If you're sleeping in the same bed, the chance might go up to 1/3. But it's not terribly contagious, and in the United States, nobody is going to catch it. I really don't think anyone will.
Well, and that's the thing, Nurse Nancy, as you're looking at this and looking at the skepticism that I think we all three can agree does exist amongst most people when it talks about viruses that are coming on. What do you see, and what would your steps, what would be your suggestions you would give to families, whether or not when they should panic or when they should just dismiss the situation?
Well, that's very difficult because the media doesn't help you, right? They want you to panic.
Right.
Nicole?
Nicole?
Yeah, I agree. I think what's happening is they're using fear to try to drive the narrative, and people need to understand that, like we've been saying, this is a very low-risk viral disease when it comes to person-to-person contact. The likelihood of coming in contact with this is very rare. So we want people to understand that, basic hygiene, hand washing, keeping your surfaces clean, making sure that your environment is clean are things that you can do very easily to protect yourself. And again, this is not something that even has any kind of vaccine or anything in the mix right now that you would want to even entertain anyways. And so it's just basically monitoring and having that supportive care if you were to come in contact, which again is just done from the healthcare standpoint of, watching you and seeing what symptoms you may develop, if any.